My name is Windowson. I'm a consultant plastic surgeon. I'm also one of the medical directors here at Cosmetic. So I'm a plastic surgeon. I do everything plastic surgery related, including cosmetic surgery, reconstructive surgery. That includes breast surgery, body surgery, what else? Laser surgery. So I have been a consultant plastic surgeon for 13 years.
My name's Raine. I'm one of the plastic surgeons that works here at St Helens Hospital, and I've been a consultant plastic surgeon for just under 20 years, and I specialise in cosmetic practice pretty much across the board. Facial aesthetic surgery, body contouring surgery, massive weight loss, body contouring surgery and so forth.
I think the first time I saw an operation in plastic surgery, I thought, oh, that's for me. I'll be a plastic surgeon. That's it. I kind of enjoyed every surgery that I did, but plastic surgery, I think, is for me. Yeah.
What inspired me? I had an interest in plastic surgery, so it's something that always fascinated me about reconstructive procedures and how techniques have been designed to reconstruct areas of post-trauma defects and post-surgical defects. So that's probably what I was inspired most about.
A typical day involves waking up pretty early, going into one of several hospitals, maybe doing a ward round, perhaps doing a clinic and then an operating list or an all-day operating list, and sometimes even a clinic in the evening. And yeah, sometimes I'm on call. I'm on call 1 in 7 days or so for the NHS, but obviously if I operate in the private sector, I'm on call 24/7. So today, for example, we're doing 4 operations. That's a full day's operating. So surgery today is ranging from 4 hours to 1 hour, depending on the case, the complexity.
Varied, actually. I quite like having a varied practice, so I don't think I really have a favourite. So I like doing a variety of things on the list that I do.
Probably body, so breast and abdomen, abdominoplasty, and probably any type of breast surgery really, so ranging from mastectomy, breast reduction, breast implants.
Major body contouring surgery, it's not really a high risk procedure, but there's a lot of work that needs to be done. It's quite a long operation, and so you have to do it extremely carefully, but the risks nonetheless are fairly well controlled with the modern techniques that we have.
It's difficult for me to determine that in one consultation. They've usually gone through a process by the time they see me, so they've not been vetted, but I think if a patient comes to you, they've usually done their research, they usually know what they're after, and you're basically just guiding them. It's very rare that you find a patient who's not suitable for surgery. If they're not suitable, I certainly tell them, and in fact I spend most of the consultations trying to put patients off, and I think that's quite a good filter. Just telling the risks, just explaining, that not every single procedure will go perfectly. It's difficult to guarantee that, and there's certainly never any guarantees in surgery. And I think patients sometimes have realistic expectations, not always, and I think it's matching up what you can achieve with the patient's expectations. It's difficult. I mean, we have various adjuncts to consultations. We have 3D cameras. Every consultation is different, but it's covering a full gamut of their history, examining the patient, explaining the options to them, the best options for them, and then sending them away and giving them time to think about things, and then get them to come back, and if they're keen, then they will do that and rediscuss options, and then go from there. I do spend a lot of time talking about the complications of surgery, and it all sounds very doom and gloom, but that's my job.
I think the biggest change has probably been the move towards day case surgery. So when I first qualified, many of the patients we now do as day cases would be an overnight stay, sometimes even several days. We use much less drainage tubes than we used to, so a lot of the procedures we do are drainless, so there are no drains involved. Nearly all the stitches we use are dissolving. That's a little bit different to in the past, although in the face frequently we still use stitches that need to be removed. Other techniques have been introduced. Fat grafting, fat transfer is a relatively new technique in terms of cosmetic type surgery. And some of the equipment that we now use is more advanced than it was when I was a trainee or when I first qualified.
I mean, I think techniques haven't changed a huge amount, and it's just about refining. And I think as you go on in life and surgery, you just become more refined. But surgeons are creatures of habit. It's a matter of making sure that you're doing the right thing all the time. And as things change, for example, breast implants, and techniques and technologies to do with implants, then you just got to keep up to date. And that's by going to meetings, speaking to people, reading journals, etc. I think the 3D camera has probably revolutionised how we do breast surgery in particular, but we've been using that for at least 8 years, so it's not a new thing to us.
I think the variety, I quite like the variety of things I do, so I like seeing patients in the outpatient clinic. I also like seeing them through, obviously, their entire journey from initial consultation through the surgical procedure, post-operative recovery, and then in the clinic following the recovery. And so I enjoy that, and so the variety of seeing different people, different walks of life with different areas of concern. I suppose I'm very used to it now. So long hours can be stressful, so it is quite a long day when we're operating from 8 in the morning till often 8 in the evening. But you get used to it after a while, and it's not something that really stresses me too much anymore.
Yeah, it's a myth. I mean, cosmetic surgery is a broad term, isn't it? And I think anything that changes your appearance is deemed as cosmetic, but there are plenty of medical conditions that affect the way you look in men. Absolutely not. Obviously, there are plenty of things where you do see the results immediately, but most things take up to a year, I would say, to see final results. Yep. And it's quite difficult to convey that to a patient. Nope, absolutely not. No, that is not my experience. It's very rare that we leave no scars. Scars are permanent, they're always there. You can have good scars, bad scars. Some scars are problematic, but it's unpredictable. Absolutely not. What is vanity? It's changing your appearance for a good reason, and that's not always vanity. Absolutely not. All surgeons are very different. Plastic surgeons also do other things. So some people call themselves cosmetic surgeons, but not plastic surgeons. Some people are plastic surgeons, maxillofacial surgeons. Everyone is different. Everyone is different, and they have a different scope of practice. And what we try to do here is reflect all of our surgeons with the practice that they do, both in the independent practice and on the NHS. So can be, but not always. Not all of them. Some do, but absolutely not. Unless it's in my hands.